Chapter 11, Poisoning and Substance Abuse. Okay, poison is a substance that could cause illness or death when eaten, drunken, inhaled, or injected, or absorbed in relatively small quantities. EMR patients can save patients' lives by quickly recognizing and promptly treating serious poisoning. Okay, poison can be classified according to the way the poison enters the body. Ingestion, which is obviously the most common form of poisoning. Poison enters through the mouth and is absorbed into the digestive system. Even things like food poisoning and things like that come to mind. Accidental overdoses, falls and things. Inhalation comes to mind when we think about when we spray trees with insecticides, our fruit trees, things like that, while putting chlorine into the swimming pool and the wind blows the dust back into your face. Inhalation, we breathe it in. All right, injection, when poison enters your body through a small hole in the skin, either caused by a syringe and a hypodermic needle, by a snake bite, by a scorpion sting, bee sting, something like that, injection. And then absorption when poison enters the body through the skin. The skin is intact, but it still gets into the circulatory system. All right, whenever we're assessing a situation with a suspect poisoning, we still use our size up the scene, primary assessment, history taking, secondary assessment, and then constantly reassessing the patient until higher help comes along to help us. Okay, general assessment and treatment. We follow the patient assessment sequence, obtain a thorough history from patients or bystanders, be alert for visual clues that may indicate poisoning. Much of emergency care depends on the patient's signs and symptoms. Okay, we treat symptomatically. General signs of poisoning history, a history of ingesting or inhaling, injecting or absorption of poisons. Okay, respiratory, deep breathing difficulty or dyspnea, decreased respirations, and then hopefully not complete loss of breathing or respiratory arrest. Digestive issues, maybe nausea, pain, vomiting, serious abdominal pain and diarrhea. Central nervous system, altered mental status, delayed, dilated pupils, things like that. Convulsions, and the things would lose. Signs that you might see on the outside: excessive salivation, sweating, cyanosis, blue lips. All right, empty containers, syringes, needles, things like that, medicine bottles. Okay. A hell of a lot of people die from overdoses of drugs every year, not just in the US, but everywhere in the world. Most deaths are due to opioids, like fentanyl, heroin, oxycodone, morphine, things like that. I see fentanyl is the new deadly drug on the street. Even just a sniff of it is enough to put a patient into cardiac arrest. I see a lot of video clips on police when they've been searching these people with the stuff on them and making arrests and things like that when they're overcome by it. Ingested poisons. More than 80% of all cases of poisoning are caused by ingestion. Okay, chemical burns, odors, and stains can be found around the patient's mouth. There could be signs where the skin looks like it's peeling off, that type of thing. Unusual breath odors, nausea and vomiting, abdominal pain and diarrhea, and then that discoloration around the mouth. Obviously, with all poisons, there will be, or there should be, a bit of an altered mental status eventually, and we need to get them help as soon as possible. Try and identify the poison, calling national poison centers. There are poison centers in South Africa as well, where we can phone and get help what we need for whatever we need to do. The best bet is to get them to a hospital as soon as possible. arrange rapid prompt transport to hospital. We don't make patients vomit or anything like that. We try and keep everything under control. Activated charcoal can be used, you know what kind of poison it is, to bind the poisons, thereby preventing the poison from being absorbed into the patient's digestive tract. All right. Do not give a patient who has ingested acid or base or petroleum-based product or is unconscious. We obviously can't give water to mixed with anything. All right, activated charcoals, usually served up in a cup with a straw, although I have been seen it given to a patient in large amounts and bottle full and asked to drink it down as quickly as possible. Vomiting, do not induce vomiting. Okay, we don't want to encourage any vomiting of any sort of thing, because if it is an acid or something like that, it might make it worse when it's vomited up. It might burn all the tract tissues and things like that. We never know what is going to happen. Some poisons obviously are only activated by water, like Ratex and things like that, so it's not always advisable just to run out and give them water with activated charcoal. There may be a different option we can use for these type of things. Inhalation, poisons that are breathed in, okay, if toxic substance is breathed in or absorbed into the lungs. Carbon monoxide comes to mind. It's a very dangerous gas, usually fumes from generators. We seem to be having a lot more generators going these days, okay. Other types of gases could be chlorine gas or ammonia, could be organophosphate poisons. While spraying the fruit trees, you get a bit of ingestion or inhalation, of organophosphate poisons, insecticides. They cause a lot of distress, respiratory distress. Remember, these things are breathed in, it's affecting the lungs. Could be dizziness, coughing, headache, hoarseness, confusion, chest pains. Okay. Also, it could also cause things like dyspnea, difficulty breathing. Signs and symptoms you may see, use of accessory muscles to try and breathe deeper, things like that. Carbon monoxide poisons generally occur from heating or heating appliances or smoke in buildings, things like that. Could be caused by generators, the fumes from generators. Small quantities of carbon monoxide can be very dangerous due to its ability to bind the hemoglobin on the red blood cells, so the body can't absorb oxygen it should be. CO poisoning or carbon monoxide poisoning causes severe headache, nausea, disorientation, unconsciousness, and maybe flu-like symptoms. If you find several patients together, report these symptoms, remove everyone from the structure or the vehicle. Ammonia is found obviously with agricultural settings, and also cleaning agents. It's very strong. It can be very, very irritant to the skin as well, burn the skin severely. A deep breath of ammonia could cause a patient almost to pass out, cause you to violently cough, lose your breath, things like that. People who suffer from things like laryngospasms and that type of thing would obviously be more affected by these things, because there's a chance that the throat is going to close and not going to be able to breathe properly. Right, going to continue with irritants. Fertilizers, things like ammonium nitrate, fertilizers carry ammonia, can be very, very toxic or irritant towards the lungs and things like that. Obviously, if you can, use a mask, self-contained breathing apparatus. Chlorine found in swimming pools and water treatment plants, severely irritating to lungs and upper respiratory tract. Can cause violent bouts of coughing, can burn the skin if it comes into contact with the skin, and it is definitely encouraged for people to wear some sort of protective clothing, and be in a well-ventilated area when using chlorine. Okay. There are often hazards when we deal with normal road type things, incidents as well. Okay, you will see warning signs, corrosive signs, flammable signs, things like that. All these hazmat or hazard signs are visible when you see vehicles and containers and things like that with different chemicals in them, you know which ones to avoid. Treatment for inhaled poisons, obviously if the patient is not breathing, begin mouth to mask breathing. The patient is breathing, administer high doses or high volumes of oxygen. Bag valve, not a bag valve mask. If the patient is alive and breathing normally, we use a non-rebreather mask with a high flow rate. Okay, and obviously we need to arrange rapid transport, evacuate large amounts of people from buildings if there are too many people in there. Okay, injected poisons. Well, there are two major causes of injected poisons: animal bites and stings, toxic poison injections, drugs, things like that. Major symptoms, signs and symptoms of injected poisons. Obviously, if it's a bite, you'll maybe notice that there's swelling, discoloration, even bleeding at the site of a bite. Tenderness and swelling, definitely. Red streaks from the injection site, indicating the poison is traveling. Weakness, dizziness, localized pain, itching. In the case of some things like scorpion bites, excessive pain, burning in the area or the whole body in the skin where the poison affects the nerves. Bleeding, especially some sort of snake bites, it can cause lots of excessive bleeding. Mamba sometimes. Worm slung definitely causes a hemotoxic poison, causes excessive bleeding at the site. Excessive swelling with cytotoxic poisons. Your violent spider, recluse spider, brown sac spider, those type of things cause massive amounts of tissue necrosis at the site of the bite, puff adders, night adders, things like that. Keep the patient calm and still. Obviously, we don't want them to move. The less they move, the less the poison will move. There's still no clue as to why the poison moves from the body into the lymphatic system, but it seems to do that, and that's how it moves around the body. Obviously, wash the site with some soap and water. Remove stinger if it's a bee sting or things like that, and the sting is still stuck inside the body. Use a knife to scrape out in the opposite direction. Okay. Apply ice packs to reduce swelling and pain. Some people may experience an extreme allergic reaction, going to anaphylactic shock. For these people, we need to help them use, if they have auto-injectors, EpiPen, epinephrine, or we would have to arrange rapid transport to them to the closest medical facility so they can get proper treatment, otherwise they will die. All right, signs and symptoms of anaphylactic shock. The first thing you'll notice is an itching on the skin, a bit of hives, swelling, rash, bumps and that in the skin, respiratory distress, dyspnea, wheezing sounds, general weakness, unconsciousness, and eventually coma if they can't breathe, the blood pressure drops too low, there isn't enough circulation, and there's no oxygen going to the vital structures. Okay, signs and symptoms of anaphylactic shock a little bit more. Rapid, weak pulse, shallow breathing, almost panting, rapid, decreased blood pressure, like I said, because the swelling, the fluid that's causing the swelling has to come from somewhere, so it reduces the blood pressure. Hypovolemic shock, and then cardiac arrest. Brain cells can only live about 3 minutes without oxygen. Heart muscle cells, about 8 minutes, 8 to 10 minutes without. So you're going to have death fairly quickly as soon as the patient can't breathe anymore. Obviously, we need to maintain ABC. If the ABC fails, then circulation, airway, breathing. CPR is needed to keep the patient alive. Administer oxygen if available, high flow rates, non-rebreather masks, 10 to 15 liters per minute, and arrange rapid transport. Obviously, remove the allergen if possible. If the patient's condition progress, point of respiratory or cardiac arrest, begin CPR. Immediate rapid transport to hospital. Okay. Obviously, if the patient's experiencing anaphylactic shock, we must know that they may have a treatment, a measured auto-injector, or the treatment to the use of auto-injector. Obviously easy. You take the caps off both ends, find the large thigh muscle, okay, secure it, push the pen into the leg, the needle will deploy automatically. You must hear it click. Hold it firmly against the thigh for about 10 seconds, no shorter than 10 seconds, because that's how long generally it takes for that liquid to inject into the body. Remember, when disposing of the auto-injector, the needle might still be exposed, so we need to make sure we do it so in a safe way. All right, absorb poison, things to the skin. It's quite easy to absorb poison through the skin. People think the skin is quite it's not difficult, not easy to get things through the skin, but insecticides pass through the skin very easily. Okay, from personal experience, I know that if you get insecticide in the skin, you may feel a slight paralysis or numbness in the skin. May cause things like a bit of nausea, dizziness later on in the stage. Always wash the skin, rinse it off quickly as possible. There may be inflammation in the skin. Okay, rashes, burning, itching, nausea, dizziness, shock. Okay. If you can, if it's a dry powder, brush it off. Don't wash it. Okay. Because it may become more active and burn with your water. If you have a facility available, a deluge shower, get the patient into a deluge shower. In other words, it's a rapid deployment of water under high pressure, washing everything off the patient as quickly as possible. Make sure you wash off all the clothes and get them out of their clothes as well, if that could remain in the clothes as well and continue to burn them and things like that. All right. With all of these things, we need to arrange rapid transport. We also need to explain to the emergency medical services that there could be a hazmat situation as well. They need to come prepared. And everything is treated symptomatically. Give high flow rate of oxygen to all these people, especially those that are suffering from anaphylaxis. All right, nerve agents absorbed through the skin as well, breathed in any way that can get into your body. Most common one that comes to mind would be like something like sarin gas, agent V, VX, things like that. There's usually an antidote, an injectable antidote with a metered dose inhaler. There's some of these things on this table that will give you some symptoms, signs and symptoms: salivation, sweating, okay, lacrimination, excessive tearing in the eyes, urination, defecation, drooling, diarrhea, gastrointestinal upsets, cramps, emesis, vomiting, and muscle twitching. Pinpoint pupils as well. Phlegm would be the word to use there. All right, there's definitely additional symptoms of the organophosphate poisoning: shortness of breath, slow heart rate, weak muscles, twitching and paralysis, slurred speech, seizures, loss of consciousness. Okay. Definitely be careful, be aware that you may be entering a hazardous area, hazardous materials might have been used there, and rescuers need to stand off for a while until it can be established what type of poison or things like that was used. I know in organophosphate poisoning, the body sometimes leaves odors, lets the odors off, smells, and these odors could contaminate or cause the rescuers to become ill or even die. All right, antidote kits. There's a duo auto injectors, 2 syringes that you auto inject yourself with, which neutralize the nerve agents. All right, you got to hold for 10 seconds, same as an EpiPen. Okay, ensure that you get the whole dose of that. Don't move the needle or the pen until you are sure that you've had enough time for that stuff to inject into the body. Substance abuse, obviously, substance abuse is a thing that's grown and grown and grown. As people become poorer after COVID and things like that, and the isolation, more people get involved with alcohol and things like that. Alcohol is readily available, and thus it can become a problem. You obviously, the more alcohol is involved with vehicle accidents, the more deaths you will come across, murders and suicides. Okay, symptoms of alcohol intoxication are similar to those of medical illnesses, but be extra careful with your examination. All right, alcohol is addictive. It's a depressant drug. People's physical dependency on alcohol can develop severe withdrawal symptoms. DTs, delirium, tremors, shaking, restlessness. I've seen people that were alcoholics that have been drinking that confusion and hallucinations. Hallucinations were terrible, absolutely uncontrollable. They ended up in hospital with having to be taken off at a slow rate and a controlled manner. Okay. DTs are serious medical emergency and can be fatal. You need to get them to hospital as soon as possible. Drugs, always look for signs and symptoms for drugs. People got to neglect their bodies as well. Their clothes become all tatty. They look like they're homeless. Not always, just in very serious cases where people are forced into situations where they shouldn't be. Drugs can be ingested, inhaled, injected, or absorbed into the skin. Look for the clues of the type of drug is administered, needle marks, paraphernalia, things about drugs, or things that you use for drugs around there. Even in recent years, the use of prescription drugs, people get addicted to painkillers, things like that. The more they take, the more they need. All right. They stimulate or depress sometimes the central nervous system. Speed, ice, crystal meth, cocaine, crack, rock, crack, whatever, synthetic stimulants such as bath salts. Signs of amphetamine use include restlessness, irritability, talkativeness. It keeps the patients from harming themselves and transport them to a facility as soon as possible. I know with ecstasy and things like that, the patient signs and symptoms you'll see on a patient, their jaw will become almost chatty. It looks like they're shivering, or they keep moving their bottom jaw and keep drinking water and things like that. Okay. Pain relievers, opiates, and heroin. Fentanyl being the most dangerous one that seems to be sticking its head out these days. Obviously, morphine, codeine being banned in many countries around the world, and painkillers and things. Signs and symptoms of opioid drug overdose: slow, difficult swallowing, shallow breathing, no breathing, smaller pinpoint pupils, weak pulse, low blood pressure, cyanosis, blue lips, blue fingernails, drowsiness and disorientation, delirium, coma, and hopefully not death. Narcan or naloxone, their medication can rapidly reverse the effects of opioid drugs on the central nervous system. Okay, and now available in intranasal application or an auto-injector. It's quite possible that we can use those things if you have them in stock. There we go. I saw one being used on a police officer that had a fentanyl exposure the other day, and it was only just keeping up with the effects of the fentanyl. Right. Intranasally, you need to obtain medical direction as per protocol. A poison center or a paramedic would be the only really help you could get for these things. Okay. Obviously, when we're dealing with things like fentanyl, because I've explained how dangerous it is, we need to obviously have PPE, personal protective equipment, gloves. Do not let it get onto your skin. Okay. Wash the clothing, expose wear of masks, all those kind of things. You've got to be exceptionally careful for this stuff. As I say, even experienced people that deal with it on a daily basis are being poisoned by it, and in some cases they're dying because of it. Obviously, there's hallucinative drugs, LSD, psilocybins, some of the mushrooms, things like that. Okay, there's a lot more chemicals that are used these days. DMT and things like that can cause severe hallucinations, convulsions, even comas, heart and lung failure, strokes. Okay, try to reduce auditory and visual stimulation, block the ears and close the eyes, put a patch or something over the eyes, approach the scene with caution, and arrange transport. Abused inhalants, intentional inhalation of violet chemicals. Many of these substances can be bought in hardware stores. Thinners, glue. I've seen people back in the army days inhaling fire extinguisher chemicals, spray and cook, anything they can get to get their high. Okay, it may cause drowsiness, unresponsiveness, seizures, sudden cardiac arrest, and things like that. Try and keep the patient calm, reassure them. And obviously, if it's needed, the ABCs fail, high flow oxygen as soon as possible, monitor vital signs, CPR if required, hey? Rapid transport to hospitals. Toxic injection, patient's reaction depends on the quantity and type of drug injected. Signs and symptoms: weakness, dizziness, fever, chills, maybe a bit of hallucinations, things like that, depending on what they've been injecting. But definitely a view that they look stoned or high or something like that after they've been using these things. Also look for injection sites, bleeding, sores on the skin where the arteries and the veins are, and things like that. Treatment for overdose, as with everything, treat for shock, keep the patient from hurting themselves, provide reassurance and emotional support, and arrange rapid transport to hospital. Okay, if you're trained to, you can always give naloxone or Narcan to try and counteract the effects of the drugs. Suicide or attempted suicide is the same. Treat emergency treatment, get them to hospital as soon as possible. Those are the type of things we've got to look for there.